Well, hello, it's Bruce Williams again, and today I want to present the fifth lecture in my series on the selected gross pathology of the urinary tract. This one's going to be pretty short, and we're going to cover fungal, protozoan, and Helminth diseases of the kidney. Now, the reason this is a short lecture is most of these agents aren't host adapted to the kidney. They end up in the kidney as a result of systemic infection, and a lot of them don't leave really good gross lesions. So there's probably more diseases that we can think of within these categories of the kidney, but I've picked some representative ones with wonderful lesions. Before we do that, as I always say, I want to thank my friends and colleagues who provided me these great images over the years, which allow me to put these lectures together. First, we'll start with fungal diseases. As we said before, these agents generally don't target the kidney. They are part of a systemic infection. When we talk, there are two classes of fungi which will affect the kidney. One are the dimorphic fungi, which generally are inhaled as part of a mycelium, and because they're inhaled, the vast majority of them really do most of their damage in the lung. But the yeasts that develop in the lung will get into macrophages or sometimes directly into the bloodstream, travel around the body, causing infections in a wide variety of organs, and the kidney is as susceptible, or perhaps a little more to the extensive blood supply it has, to these infections. The opportunistic fungi are also seen occasionally affecting the kidney. This is often seen in immunosuppressed animals, and most of these agents fall into the category of Aspergillus, the genera of Aspergillus and Candida. Candida is one that's always present in the body, but in animals that are immunosuppressed can cause a systemic infection. We're looking here at the kidney in a cat. It's a fantastic picture by Dr. Paul Stromberg, who, like most of us right now, probably would misdiagnose this particular picture. In earlier lectures, we talked about feline infectious peritonitis and another rule out in the kidney, which can look very much like it, feline lymphoma. Mutated coronavirus that causes FIP tends to result in granulomatous inflammation, which tracks vessels. So you often will see it in association with vessels, but that's a lot more easily determined on the outside of the kidney with that prominent vascular tree underneath the capsule than on the inside here. Dr. Stromberg will freely admit, as I will freely admit, that looking at this I would probably default to feline infectious peritonitis and then secondarily to lymphoma. But this is actually a case of renal cryptococcosis in the cat. Cats appear to be especially susceptible to cryptococcus, also horses, and cryptococcus has a habit of infecting immunosuppressed animals of a variety of species. Cryptococcus neoformans used to be the only species when I was learning them. Now we have a number of them, and it's been determined that one particular variant of Cryptococcus neoformans, variant Gaddii, has the ability also to infect immunocompetent animals. You'll see these yeast forms especially in the lung, but you can also see them in the brain, in the kidney, in just about any organs in affected animals. Now, there is one documented case of an ascending urinary tract, which was caused by Cryptococcus. That animal appeared to have been cured, but it's obviously not a very common finding. Crypto in the kidney is rare enough without having to think about it ascending through the lower urinary tract. With the knowledge that this is a dimorphic fungus, I might go with crypto first, simply because it's a cat, but there's nothing to say that it's not one of the other dimorphic fungi. We call them dimorphic because in nature they primarily exist in the mycelial form, which is the infectious form, and then in tissue you pretty much always see the yeast form. As I said before, crypto would be a good guess, but if you said that this was blastomyces, histoplasma capsulatum, or even in certain parts of the western U.S. going down through Central America, Coccidioides immitis, I would be very happy with any of those diagnoses. Maybe I'd be happy with crypto, but I would take all the rest. Oh, here's a bad-looking kidney from a dog. And we can see a lot of things going on here. We see a diffuse pallor to the cortex. We see multiple acute and chronic renal infarcts arising from both the sublobular and the sublobar vessels, or maybe even the arcuate vessels. And then we see these white areas sprinkled liberally throughout the cortex, the medulla, and even in the renal pelvis. The capsule is convoluted like we would see in chronic renal failure. And this is probably the major reason that this animal passed. And this is an animal that was infected by a opportunistic fungus, often associated with some form of immunosuppression known as Aspergillus terreus. Over the years, this particular agent has been identified in immunosuppressed dogs with a predilection for German Shepherds, and it will cause lesions, very characteristic granulomas in the heart, but it affects pretty much all of the organs, and the kidney is certainly one that is affected. Under the microscope, I think that you can identify Aspergillus terreus because the swellings in along these hyphae tend to make them look like smoking pipes. But with the history of a German Shepherd diffuse granulomatous disease, yes, it could be some of the dimorphic fungi, but I would always add this one to the list. It does exist. Aspergillus primarily exists in tissue in the hyphal form, and we know that Aspergillus, when it gets into the bloodstream, tends to cause a lot of endothelial damage, thrombosis, and infarcts. And this particular kidney shows not only the granulomatous inflammation, but also the infarction that will come with Aspergillus in the bloodstream. Okay, protozoal diseases. Once again, anything that can get into the blood can get into the kidney. I want to mention one protozoal disease in particular that we see in a couple of animal species. We can see it in non-human primates. It's been demonstrated in dogs, but is most commonly seen in rabbits. We're looking at a normal control rabbit kidney on the left and a kidney of a rabbit that was infected by Encephalotozoan cuniculi on the right. Encephalotozoan is it's a microsporidian agent which over the years has been classified and reclassified a number of times. It's probably closest to fungi. It has chitin in the cell wall, but it is considered its own particular agent. Microsporidia form spores. They are gram positive, which is very helpful in looking at infected animals, and it tends to infect both endothelial cells, which is how it gets into the kidney per se. If microsporidia get into the bloodstream, they have the ability to travel around the body, and if they infect endothelial cells, then they get entrance into the kidney. They are very happy living in and making fairly large cysts within the epithelium of the renal tubules, and infected animals often have chronic infections and shed these spores in their urine where they will infect other animals. And rabbits are probably the species where it is seen the most. You can see it in wild rabbits. You can see it in pet rabbits, rabbits from the pet store. And when I first started as a resident, we routinely saw this in the laboratory animal colony rabbits at the Armed Forces Institute of Pathology, but I haven't seen this probably in 20 or 25 years because, the producers of the rabbits got hip to this very quickly. And that it was interfering with research. It does cause granulomatous infection, primarily in two organs, in the kidney and in the brain. In the kidney, you can see that the characteristic lesion is this pitting of the kidneys. You have granulomatous inflammation. Well, you have infection of the tubular epithelium, rupture, inflammation, which eventually becomes granulomatous inflammation, and fibrosis. Remember, when you lose nephrons, you don't replace them. They scar in, and eventually that scar tissue, like all scar tissue, is going to contract and give this pitting appearance to the renal cortex. The other thing that you'll see are granulomas in the brain. Not really big, ugly granulomas, but small focal granulomas with macrophages, which ultimately will sort of resolve and become glial scars. But it's very characteristic in rabbits, and I enjoyed it when I was a young resident because it was something that I got pretty good at picking up on. But you can also see this in dogs, and you can see this in non-human primates as well. There are other protozoal agents that will affect the kidney. There are forms of coccidia, Eimeria truncata in geese, Glossiella equi in horses, and cobaye in guinea pigs. They don't really cause great characteristic gross lesions like this particular agent. So I've pretty much left most of the protozoa out. Not saying they're not important. I'm just saying that they don't give us really characteristic lesions. So they're outside the discussion of gross pathology. But they're important. They're unique. The Glossiella and that form of Eimeria are really nicely host adapted. They generally don't kill the animals, so they're certainly worth a look into Jubb and Kennedy or into Vispo. Okay, and finally we're going to talk about just a couple of important helminths, really only two. And the kidney doesn't have a lot of worms that are attracted to it. It is not part of the external environment, so access is difficult. We have a large concentration of most of our helminth parasites in those organs in which the lumen is essentially the external environment, the gut, the lungs. But the kidney doesn't connect. It does connect if you consider, having to go all the way up to the urethra, the bladder, the ureter, but that's a long trek. And pretty much nobody makes that trek in terms of helminths. All the helminths that get to the kidney get to it through migrating through tissues, and there really is only one, the one that we're going to focus on the next couple slides, that has a tropism for anything renal. This is a great picture by David Dodd taken way back in 1962. And this is a pig kidney. It is opened up, and this is presumably the ureter of that kidney or the other kidney in this animal. And you can see these large red worms within the renal pelvis, within the perirenal and periureteral fat. This particular agent is known as Stephanurus dentatus, and used to be a huge problem, especially in some of the wetter areas of the South back when pigs were raised outside. They were raised on soil. Nowadays, in more modern ways that we produce swine, where they're kept inside, this parasite is almost never seen. It's a large strongyle, and it causes damage to the pig in a number of ways. It doesn't kill pigs. For the most part, it's a very rare exception when it kills a pig, but it causes a decrease in food conversion. The animals won't put on weight, they may be emaciated, and that's obviously not what you're hoping to do when you're raising pigs. It is one of those helminths that really travels. It is ingested. The eggs are ingested from the soil. Occasionally, earthworms are incriminated as intermediate hosts of this particular agent, but the pig is rooting around in the soil and it ingests the eggs, and they will break out of the intestine in their larval form as third stage larvae and begin a very widespread migration, maybe one of the most widespread migrations of any helminth parasite in any species, and they pretty much go everywhere. They can do a lot of damage when they go through the liver. Liver is one of the organs that is primarily hit by this migration, because coming out of the intestine you often get into the portal vasculature and takes you right to the liver, and then they break out and they start traveling, causing a significant necrotizing and eosinophilic hepatitis and extensive fibrosis. And the result of that particular migration is a form of scarring in the liver, which we call milk spots, and a major condemnation of pig livers at slaughter. But they go all over the place, and they will cause mild disease in the lungs. Pigs can have ascarid migrations and migrations of Stephanurus and get a minor form of respiratory disease known as thumps or summer sickness. But that's the migration of the larva in heavy infections. Pigs it's even been documented go through the nervous system, resulting in neurologic signs and paralysis or posterior paresis of these. But eventually, a large percentage of those larvae will make it back, where they will get into the renal fat and sometimes into the kidney proper. The females will... Let me show you another picture. I keep droning on and on, but here's a really nice picture showing the adult females in the parapelvic fat, and they can produce up to 1 million eggs a day. They will lay the eggs into the renal pelvis or sometimes into the lumen of the ureter if they're encysted there, and then they will continue the life cycle. And these females can live for up to 3 years. So if you multiply 3 times 365 times 1 million, that's like several million eggs that they will produce in a lifetime, or maybe a lot more. So it could be a problem. I see some white spots on the top of this kidney, and that may be scarring from migration of worms into the kidney. I also see a little cyst. We've talked about renal cysts, especially these incidental types. Yes, you see a lot of large cysts in pig kidneys, but you see some small ones too, and I don't think this is really causing this pig any particular problems. And then just one more image of Stephanurus dentatus. They don't all make it back to the they don't always make it back to the kidney. This one decided probably to encysted. These may still be migrating, but they're pretty big, so they probably encysted here in the omentum, and they may be laying eggs, but they're certainly not going to continue their life cycle. And I want to talk about one more helminth parasite that I think is very interesting. We get this is a picture from the Wednesday Slide Conference back in the 2000 and aughts, and we get maybe 1 or 2 of these a year because it's a very interesting parasite and a very interesting life cycle, primarily seen only in horses, but there have been cases in humans as well. And we're looking at a incomplete section through the right kidney of a horse. Remember, it looks like a little Valentine. And these large areas of coalescing white tissue are areas of granulomatous inflammation due to the migration of this particular parasite, a rhabdiform helminth known as Halicephalobus gingivalis. This is one that has undergone a number of name changes in the past. First it was Halicephalobus deletrix, then for a hot minute it was Micronema deletrix, and then it went back to Halicephalobus, and then they've changed the species name, which is somewhat unusual, but it's now called gingivalis because of the lesions that it causes within the gingiva. This is a free-living parasite which normally is found in moist, decaying plant matter, especially in the southern United States or the southeastern United States. And it is picked up by the horse, generally from, and it can come in a number of ways. It can come in through inhalation, but a lot of times it will come in through percutaneous methods. If the animal is laying in this sort of moist, wet matter, it can penetrate the skin or more easily find a mucosal-lined orifice like the prepuce or the vulva or a wound and get into the body that way. It's very interesting in that it migrates along blood vessels. So it's this perivascular migration through the tissues. It doesn't take the easy way like going through the bloodstream, but it migrates along and in the adventitia of blood vessels to get wherever it wants. It seems to have a couple of particular targets. The brain, especially the ventral aspect of the brain and the optic nerves, are frequent targets, and the kidney is another frequent target, and it eventually will replace large amounts of renal tissue with granulomatous inflammation and fibrosis. Even more interestingly, the presence of male worms has not been documented in these infections. Only female worms and philarid larvae are present when you section these, and it's given rise to the theory that these might be parthenogenetic infections, which mean that the females can lay eggs or give birth to larvae without the presence of males, or perhaps that the males may fertilize the females before they enter the body. So the males have been found in that decaying plant matter. That one seems a little far-fetched, that you have to be a gravid female to invade tissue, but I'm sure there are odder things that happen in nature. So I think most people subscribe to the theory that these are parthenogenetic infections. I said that the brain and the kidney are often infected. You can find them as shallow ulcers around the teeth. That seems to be another way that they will gain access to the body and through the mouth. And there are, if you go back to the Wednesday slide conference, there are a number of one-offs. Like last year we had this in the adrenal gland. So I think they migrate along those vessels. They end up where they end up, and they cause significant damage and granulomatous inflammation. Halicephalobus gingivalis. Well, that brings us to the end of this very short lecture. In the next lecture, as we so often do, we're going to combine the nutritional, metabolic, and toxicologic insults to this particular organ. And in the kidney, there are really a lot of toxins out there which will affect the kidney. Not as many leave good gross lesions as you would expect, but we're going to try and cover a couple of those and the pathologic mechanisms associated with them. With that, I'm going to sign off for this lecture. I wish you good health, good luck, great happiness, and please stay safe in these troubled times. And I'll see everybody tomorrow.